Yeah. Hi, ma'am. Can you hear me?
Yes, yes, I can.
Yes. So I think everybody here who has joined us on YouTube is hearing both of us. Yeah. So I'm very pleased to inform everyone that I have invited Dr. Khatuna Makalatia, who is the dean of who is the dean of the Faculty of Medicine in the Teaching University Geomed. So she'll be also sharing the detailed insights about the medical faculty in the University Geomed. So first of all, I would welcome you, ma'am, here in my YouTube channel, and we are very excited to have you with us today and share details about MBBS in Georgia.
I'm sorry, your voice was interrupting. If this question was to me, please. Your voice is coming with some sound, then that's
Uh, just a minute, ma'am.
why.
Just a minute. Just a minute. I think there's some error with the audio. Is it fine now, ma'am?
Yeah, yeah, it's better now.
It's better. So you can hear me, right?
Now, yes, yes, I can.
Yes, yes. So I was mentioning that we were very delighted to have you on board, and to share your valuable insights about the medicine program in Georgia. So, can you just briefly tell us about the University Geomed, when it was established, and how many batches so far has graduated from the university, and how is your experience dealing with the Indian students?
Okay. Thank you for the invitation. It's my honor to be here and to introduce my university. So, the University Geometry is focused on medicine. We have four different faculties there, but for the international students, we have only one faculty, which is the Faculty of Medicine, and I'm introducing that faculty. How many batches? I think already we had 8 batches graduated, or 7, maybe I'm mistaken, but yeah, something like that. And I would say that on this International Faculty of Medicine, majority of students are Indian students. So we have students from other countries as well, like Nigeria, Iran, Azerbaijan, so on. But majority of our students are from India. Besides Georgian students as well, we have separately running the same program only in Georgian language as well. So these two programs are going simultaneously for international students and for Georgian students. Yeah, what can I say about the program itself? Program is accredited by National Quality Education Quality Insurance Organization and by international quality organizations as well. Recently, we got EQUIN accreditation, which is a European organization for accrediting educational programs. So that means that our program is good enough. Otherwise, we couldn't get this kind of accreditation, and this is improvement of the quality of education which we are giving to our students. If you need to clarify more detailed like topics, I'm ready to listen to your questions.
All right. Thank you so much for giving your valuable insights and details about the medical program in the Teaching University Germany. And also, we're also very happy that the program of education of the globe.
Your sound is still not stable. Some sound is coming.
Is it getting audio?
No, some like sound is coming with your speaking. That's why I cannot hear you.
Is it okay?
Not I think it's better now. It's more calm.
Is
Yeah,
it?
can you? I think yes.
Okay. Okay. So
The
yeah.
discussion. Yeah.
Okay. Yeah. So other than this, I just wanted to know whether the program is accredited globally.
Whether they
The program is accredited globally.
whether the program what? I'm sorry.
I'm just asking whether the program, the medicine program in Geomed Medical University is accredited worldwide.
Yeah, I already explained that our program is accredited by European Commitment, an accreditation, an education accreditation commitment. And if you mean validity of our diploma abroad, yes, our students, our graduates are able to continue their studies worldwide. They can continue in US, they can continue in UK using USMLE and club exams, and in Australia, so many different like opportunities like for postgraduate students are available for our students. So this first step, which has to be done by medical students in the program, is absolutely valid and recognized by different countries as well.
Okay. There's one more thing I would like to ask you about uh, regarding the preparations or the help that university is giving to the students to prepare for the licensing exams, like
Yeah.
pre-lab.
Yeah, I think I understand. It's difficult still, but I think it was about preparation classes, right? Right, for the different exams. Yeah. So first of all, I want to mention that this rate and the passing percentage of FNG exams, for example, which we have, and we have quite good results if you check, quite high passing percentage by our graduates. That means that our graduate has good education, and that means that our program is working effectively. So because of that, they have these results. And besides that, of course, it's very important to highlight the motivation of students, which the students' motivation is very important in post-graduation exams as well. So they are dedicated to study process. And program itself, which we run, this program content is sharing topics and strategies which are underlined in different types of post-graduation licensing exams. What I mean that type itself, our program examination pattern, which we run in our faculty, is very similar to, for example, the exam pattern two club exam pattern. So we try to make our program in accordance to the post-graduation exam requirements. For example, what I want to say, we have two main patterns that are for the admission of clinical subjects. First is multiple choice question pattern, the MCQ exam type pattern, which is test-based, computer-based exam, same as it is in case of post-graduation exams, for example. Then another one is objectively structurized clinical examination or skill exam, which is called OSCE. For example, for CLAB, it is necessary to have experience of.
Mm-hmm.
Can you hear me?
Yes, yes, I can hear you.
Because there's sound of sheet coming, and so I have the impression that it might be difficult to hear me.
Can
Yeah,
you hear me
and
now?
now it's okay.
Now it's okay.
And we run these two types of exams, two patterns. OSCE exam is done, as I told you, at the end for each clinical subject and preclinical subjects as well, like organ system non-modules and organ system pathology modules. Both of them have incorporated these two patterns of exam. The first one is midterm exam, which is done usually at the middle of subject, and this is giving to students additional opportunity to check their knowledge, where they have weak points, what has to be more focused than for the final exam and so on. These kind of like hints can be received by the midterm exam, which is also containing two partner components. First is mathematical component, and another is mini clinical examination, which is done directly at the clinic, in the clinic by doctors.
Okay.
And with participation of the patients as well, mini clinical examination.
Okay.
So these different types of exams and the pattern and strategy of program helps our students to feel more confident and comfortable, let's say, post-graduation exams.
Okay.
Okay,
So,
so
on
at
your
your giving them, this was everything what I already what I discussed right now. This is our curriculum, which is running in our university in scope of our program. But besides that, we have extracurricular activities, which are by the way offered and recommended by students themselves. So we try to follow students' requirements. What extra we can do for students. And yeah, as I already mentioned, we have a strong community of Indian students at our university and faculty, and they funded different types of student clubs. And one of them I will highlight, this is Students Academic Society, SAS, which is performing very well. They are organizing very important meetings and events. And as an example, I can tell you that they invited the famous professors over the India in Georgia. We
okay.
supported, we university supported, did the support, and at our university, in our simulation center in Dantobi Hall and in our auditoriums, they had live trainings with these famous professors. For example, first which we invited was Dr. Deepak Malwa for internal diseases. Also, there was Professor Dr. Bhavani. If I'm saying surnames with
Yeah.
difficulty, please
Mm-hmm.
forgive me.
Yes,
Yes,
yes.
and Dr. Preeti Sharma for pathology and microbiology. So besides that, they invited professor from Macedonia, and she conducted, they organized actually, the part of the university was just support. Mostly the
Okay.
content and everything was run by students. So that makes me really proud of them. They're doing really good job, and these kind of extracurricular activities as well are very popular within our students. They are looking for such kind of activities. They are attending, studying, and gaining more knowledge. So they can study one subject from different sides. That is, I guess, one of the reasons why they get good results on their MG and on their postgraduate examinations.
Okay.
Okay,
Ma'am,
ma'am,
what do
what
you
do you
think,
think,
like,
on
on as per
as per
your
your
experience,
experience,
what
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 license
license
exam
exam
usually
usually
students
students
do
do
prefer
prefer during
during
MBBS?
MBBS?
They
They
either go
either
for
go for
USMLE or
USMLE
they'll
or
try
they'll
for
try
B
for
lab.
lab. Both actually. We have experienced both these types of exams. After graduated students are trying club exams. We have already one graduate who passed first, or no, two graduates who passed the club exam first steps, and they are waiting for second step exam now. We have students and graduates as well who are passing the USMLE steps. And majority of them still go to India and try their like foreign medical like graduate examination, FMT exams. Besides that, they're finding some new ways as well. For example, one student now is requesting a recommendation from German university.
Yes.
One recommendation was uploaded by me directly on the university's Max Planck University's webpage. This was also a request from graduates, and university directly contacted me, and I provided the needful information about the student and so on. So we don't have one focus. I guess they are trying to explore more and more different types of post graduation.
Okay, so as per your detailed explanation about the post graduation, the opportunities that students are getting, once they complete their medicine from Georgia, so the university Germany is helping students, through various ways, helping them to give guidance on how to clear the license exams such as USMLE or PLAB. So yes, as per our opinion also, it's quite good for the Indian students because these days in India, students are more likely to, to seek for the other exams also. Other than FMGE, they are most likely to go towards USMLE. And hence they want a good preparation for USMLE, which is very important these days. Yeah.
Yeah. And the
So other than
question
this, sorry.
question was there. Did I miss a question or you did not finish
No,
yet?
no, no. I was mentioning that it's very important, to have a sort of guidance or preparation of USMLE exam during MBBS.
Yeah, sure. Sure. It is. It is
Yes.
important. Some subjects, clinical subjects, doctors themselves and professors, which are still teaching here in our university, not invited ones, but the teachers who are running our program actually, they are also trying to use methods which will help afterwards on this USMLE exam. The question types they try to be to like give them during the main university examinations like similar questions as it is in USMLE, for example. They try to like prepare these kind of questions and evaluate students study from this point of
Okay. Ma'am, there's one very important thing I would like to know from you is about NPDQE exam, which
which exam.
students NPDQE exam. Is it the exam which students needs to give once they complete their medicine from Georgia?
Yeah, yeah, they have to like this we call licensing exam in
License,
Georgia.
yes, exam in
Yeah,
Georgia.
they have to. Yeah, they have to pass this exam after graduation, and they are getting the registration after passing the exam.
Okay, and what about the level of difficulty of this exam? Is it similar to FMGE or what?
Yeah, it's something similar as per my knowledge because I don't have the really detailed information about the difficultness of FMG exams because I never experienced it, so it won't be correct if I would prove something for sure from about this issue. But yeah, from students' experience, I can say that yeah, it's something similar.
It's something similar. All right, all right. So the universities are also helping or guiding students for that exam.
Actually, our help is like they're not necessary there. They're great getting their graduation, like I mean, improvement of graduation diploma and supplement diploma, or before diploma they can get qualification awarding letter if they need it on earlier than diploma, and if they need to be registered there. And that's it. Their study pattern is helping them to pass this exam, so everything is same. Like our help is helping during the study process. After that, graduate help is just recommendation, giving of recommendation, verification of different requested documentation if any university or any organization where our students are applying for requesting some additional documentation. We are giving this kind of documentation. We're providing different types of certificates and so on. That is our help. After graduation, we don't have much like important role there in their study. They have to gain knowledge during the whole program, and after that, they have to prove this knowledge and education on the exams.
Okay, that's
And
wonderful actually. That's wonderful actually. Because National Medical Commission of India, it has implemented certain rules, and as far as those criterias, like if we consider those criterias, Georgia is 100% fulfilling all the requirements which has imposed by the National Medical Commission of India, including the license to practice there in Georgia. So yes, you can clear the exam if you want to license to practice over there, which is quite easy, and which is quite similar what other countries. In fact, India is also doing the same thing. So yes, more or
Yes.
less it's the same thing. The exam requirement is there, which you all need to fulfill. So, ma'am, some students have asked me the question, so I'll just tell you.
Yes.
So, one student
Yes.
has asked me, how is Geomed University as compared to the other universities in Georgia?
I don't understand the question.
One student has asked me, how is Geomed University as compared to the other private medical university in Georgia?
Actually, I don't like this kind of comparisons. I'm prefer to talk about my university. What are
Okay.
the opportunities and facilities in my university, and about other universities? I don't think that it's correct to say anything. So,
Uh,
if you are interested in any particular universities, you have to check their own webpage. You have to check their own programs. You have to check all these, what they have documentations, achievements, and everything, and you have to hear it yourself. From my side as a university, it won't be correct to compare myself with other universities. So I'm sorry, but I cannot do it.
all right. That's quite fair, actually. It's always better that we discuss about our facilities and whatever facilities we are offering to students.
And first of all, I don't have even knowledge what are the other universities offering, and I will not, take part in this kind of discussions and some, you know.
All right. Okay. So one thing I would like to ask here is about the license part. Like, is it valid for the entire lifetime, or is it restricted to certain years?
As per I know, it is valid for lifetime when you get this license, and after that, if this license is following practice as well, and you cannot get license, like you have to be practitioner. That's why you are getting license, right? That's why it's for life, as I know. Then not for temporary. It's not temporary.
It's not temporary. It's for the lifetime. Okay. Okay. Yeah. And what is the student?
Unless some accident are not happening and unless they are not canceling your license as a doctor, then it also can happen during your whole career, right?
Yeah.
Sometimes if there is some, I don't know, some problems like with law or with patient or something like that, they can cancel just
Okay.
license. But if for life long, if you take it.
Okay, 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 all right. And many students, ma'am, they are very concerned about the safety of students in Georgia. So how do you think, like, is Georgia safe for a female student, especially, studying for 6 years of a program in a different country?
Which
Is it
student especially? Which student especially?
the girl students,
Female students.
female
Yeah.
students? Yeah.
First of all, Georgia is country which has very strong women society. I would
Yeah.
say
Mhm.
women are ruling here,
Mhm.
and even our university, majority of authorities in administration, even rector is a woman. Me, I'm dean of the faculty. I'm a woman, and majority of our faculties are women. So and in general in Georgia in science and education, mostly women are who are the main role players.
That's great.
That Yes, that makes sense. And country itself is safe. I would say anytime, nighttime, you can go outside and you can feel safe because camera control is there on each street. Each street is lightened, not dark.
Mhm.
Everything is working till late hours, so it's very safe country. We don't have high percentage of crime in our country, So I can say that safety is not a problem in Georgia.
Okay, so ma'am, one student again has asked a question. He has asked me, can students do post graduation in Germany directly after completing MBBS from Georgia?
Yeah, I just answered this question. For one student, I applied myself. They required documentation for Max Planck University, which is in Germany. So, yes, that is
But
possible.
they need to fulfill the language requirements, of course.
These are their separate the requirements which are not connected with us. So afterwards, when you finish your university, wherever you go and wherever you try to apply, they will have their own requirements, and you have to follow these requirements. The university which gives you this main degree will take part in verification, in recommendation, in giving documentation, whatever are requested, but all requirements for each new step you will have new. It's not connected with us. We will just try to complete all those requirements. Where our goal is, we will help with that. But
Mhm.
about finding out which university has what kind of requirements and so on, we cannot be involved. This is your own decision where you are going to go. And after that, you have to give us know what has to be done from our side for fulfilling your requirements for this next step which you are trying to apply.
Okay, and is it really important to do post graduation to get a license in Georgia?
What you mean really important?
No,
Post-
I was asking, is it like mandatory to do post graduation to get a license to practice in Georgia?
Okay, after graduation, the first step you are as a in Georgia, you can work as a junior doctor, and after passing this licensing exam, and after that, if you want to specialize and get some particular specialization, like it is in every country, in Georgia as well, you have to do your residency program, and after that you will be you will get the license for this particular part of the medicine, like it is everywhere.
Okay, all right, fair enough. So, okay, so how important is learning Georgian language during the medical program?
It is important. Important because from the seventh semester, so communication with teachers and the lecturers not problematic absolutely because everyone speaks English here.
Mm-hmm.
That's not a field where your Georgian language is important. But after seventh semester, well, after sixth semester, from seventh semester, we conduct clinical rotations. All subjects are clinical subjects, and all of them are conducted in particular clinics. And in clinics, you will be get to communicate with patients as well, and
Patients.
not all patients are talking English. That's
Yes.
why you need simple communication skills in Georgian that will help you to understand the content of the situation itself. The doctors and nurses and all participants there who are working and who are teaching the students, they are helping, of course, with translation and so on. But still, it's better to understand Georgian language. That's why we incorporated in our program. It was requirement by the Ministry of Education, and we have mandatory classes, mandatory subjects of Georgian language. We have four Georgians starting from second semester.
Okay.
Second, third, fourth, and fifth semester, we teach Georgian.
Okay.
Georgian 1, Georgian 2, Georgian 3, and Georgian 4. It is 3 credits for each 3 credit subject, and after completing the four Georgians, you are able to communicate and to understand, and yeah, you know this.
Is there any written exam for the language subject too?
Written exam in
For the
Georgian, we have
language.
no, we have at the university we have MCQ exam for Georgian language. Yes.
Okay, and what do you think, like, as per your experience with Indian students, like, are they comfortable in speaking Georgian language within 3 years?
Okay, it depends on students. I had a student who actually graduated already, who was not only speaking, who was singing in Georgian and playing guitar very well. So it depends on the student himself.
Yeah,
If you want to learn, it's absolutely not problem. And for Indians particularly, you have these difficult sounds as well as Georgians has. So it is not problem. If student attends, if student is following recommendation of teacher, they are studying this language easily.
all right. That's really good to hear from you, ma'am, that all students can, if they are focused enough on their studies,
Yes,
they can easily learn the language.
only problem whoever has problems, that's because they are neglecting subjects. They are not attending and not studying. That is the only answer there. Otherwise, who studies, they have very good performance. They have very good results in any subject.
Okay, yeah. So, ma'am, I won't take much time of yours. I know you are very occupied and you are very busy in the university. And thank you so much for giving us your precious time for this session. We are highly obliged to you for for giving 30 35 minutes of yours. So,
My
yeah,
pleasure to
and
help
thank
you.
you so much for the genuine information about the medicine program in Georgia and your experiences with the Indian students related to the post graduation or BH learning a local language. So it was really worthy having a conversation with you.
I'm happy if that was useful for you and if that was informative. Yeah.
Yeah.
Thank you for
Yes.
the invitation.
Thank, yeah.
Thank
Thank you
you.
so much, ma'am. Thank you so much. Today.
Thank you. Have a nice day and good
Yeah.
luck
Wish
for
you the
each
same.
student. I try to continue studying to everyone, whatever is their decision.
Yes.
For everyone.
Yes, ma'am. Thank you so much.
You're welcome.
Yeah.
Bye.
Yeah. So I hope the audio is fine now. We were having some issues with audio because since ma'am has joined from Georgia, so there was some trouble with the language. So I tried to ask as many questions I can related to MBBS in Georgia. But yes, there are few things that I would like to highlight here. Yeah, so just a minute. Yeah. So one student has asked, Sanjay, English proficiency test. No, English proficiency test is only required when you are enrolling in Georgia. Is required. Licensing exam, when we talk about licensing exam, yes, it's in Georgian language. It's not in English language. The licensing exam that we have discussed with the dean ma'am, that is 100% in Georgian language. That's why it's very important to have a command on the local language. And the universities in Georgia are giving you preparation for language for the entire 3 years. And like ma'am said, you need to learn Georgian 1, Georgian 2, Georgian 3, and Georgian 4. For clinical experiences, can students go to other EU countries? Yes, definitely. Students can go to other EU countries since all the universities in Georgia have tie-ups with other European countries too, and Georgia itself has become a EU country. So yes, you can go to other European countries also for the exchange program from third year beginning. Yeah. So yes, so now let's SU college is good option for USMLE preparations. SU is a good college, is definitely a good college for USMLE preparation. It's not about the college. It's actually depends on two things. If you're willing to practice for if you're willing to apply for USMLE, there are only two things that matters. One is your self preparation, your self study, and second is the country you are choosing, because Georgia is quite renowned for giving American syllabus. They are having a mixed European and American syllabus, and hence that's the only reason why many Georgian graduates are nowadays in USA and and have given or have passed USMLE exam. Is Georgian? Yes, Georgian language is mandatory for the licensing exam. Like ma'am said, it was an MCQ based question. Like it is an MCQ based exam. So yes, language is the requirement you need to fulfill, and the exam would be in Georgian language, no doubt. But she has also mentioned uh, that to practice as a doctor in Georgia, you are just required to clear the NPDQE exam, which is, of course, in Georgian language. And after that, you can practice in Georgia. Other than this, she has also mentioned that students can directly go to Germany as soon as they complete their MBBS and can do their post graduation from Germany. So there's no hurdle in moving towards any European country for the post graduation. The only thing is you need to satisfy the language criteria. You need to fulfill the language criteria. For example, if you're going in Germany, you need to prove your German fluency. You need to prove your German proficiency at least up to B2 level. So these are the other requirements. Other than this, teaching university Geomedy, because ma'am was from teaching university Geomedy. So teaching university Geomedy is bringing such a good collaborations with German universities. They are also helping students with a very good recommendations. They are helping students with research. They are also helping students, by giving good references to the university. So yes, the university is helping students for their postgraduate and for the future prospects too. Can we do PLAB preparation? Yes, you can do the PLAB preparations. Ma'am has also mentioned that University Geomedy is bringing up with many good collaborations of institutes who are giving preparations for licensing exams such as USMLE and PLAB. And also they have also invited the Indian faculties. So let me just show you some insight of Indian faculties who are giving lectures in the University Geomedy on FMGE. Yeah. So here you can see he's an Indian doctor, Dr. Deepak Marva. He is visiting Geomedy University every month and is preparing students for the FMGE exam. He's a very renowned doctor in India. He is doing his practices in Gurgaon in India, and is a visiting faculty with the University Geomedy. So here you can see the students. Still confused. What does it mean licensing in Georgian after the graduation in English? If I apply for USMLE or practicing in India, I'm assuming Georgian language is not required. Yes, of course. To practice in India, Georgian language is not required. But since you are doing your medical studies in Georgia and you need to do the clinical rotations with the university hospitals, and there you need to interact with the local patients. Georgia is quite famous for its 90-95% population who is English speaking, but since you are doing such a course wherein the local language interaction is involved, and the interaction is directly with the local patients, and hence you should know the local language, which is Georgian, because the patients, if you see, ideally the age of the patients would be more than 60 years, and many patients are not comfortable speaking in English. So hence you need to know the basics of Georgian language. Plus, when you do your licensing exam in any non-English speaking country, except few countries that I have already mentioned in my YouTube videos, except few countries, 90% 90% times in other countries who is not English speaking, the licensing is in the local language itself, and hence learning a local language is important. Yes, and if you apply for a USMLE, then yes, local language is not required. But yes, to complete your MBBS from Georgia, you need to learn the language and you need to get the credits, because the pattern is ECTS, European Credit Transfer System. So individual subjects are, you will be having individual credits for all the subjects. So you need to complete or you need to get those credits. What are the requirements for applying MBBS in Georgia? The requirements are very simple. You need to at least have minimum 50% in PCB and your NEET should be qualified. There are people in India who are saying that you can get admission in Georgia without qualifying NEET, which is not possible. You can get admission before, without the NEET scorecard, but you will not get a visa without qualifying the NEET cutoff. So NEET cutoff is important. Minimum requirement is 50 percentile. So you need to have 50 percentile to clear, to get admission in Georgia. Okay, so let's quickly get through the other video of University Geomed.
The University Geomed has a world class of infrastructure with well equipped labs and classrooms with the addition of smart boards. And we also have simulation labs which helps us to retain our theoretical and practical skills. We also have well equipped laboratories in which we have huge collection of textbooks, as well as we have a well equipped examination centers in which the examination rooms are well surveilled with cameras so that the best comes out.
Geomed University, our university, does not only have the best tie-ups with the best hospitals, but in fact the best hospitals in entire country as well as the Caucasus region. Doctors over here help us in getting into our theoretical knowledge, in our medical conferences, in our medical researches. They also help us to in understanding a particular surgery. We take part in differential diagnosis, which helps us our diagnostic skills for the future. This has given us the best experience. Why don't you all come and experience geometry?
Yeah. So this was a brief about the Teaching University Geomed, and there is around 700, 800 Indian students who are already studying in the university. And like ma'am told, the FMG passing rate of Teaching University Geomed is better than any other university in Georgia, especially in the private medical universities category. So this is one of the good university if you are looking for quality education. Best in terms of FMG preparations, like I have said, they have invited, and some other Indian faculties are also there who are the visiting faculty of with Teaching University Geomed. 50 percentile in NEET, and in PCB 50%. 50 percentile, that means you need to have the cutoff marks. You need to at least clear the cutoff, which is the 50 percentile, and 50 percentage in PCB is required. So this is the basic criteria. Okay, so I will just also show you the simulation lab of Medical University. So this is their simulation lab. We have just covered a small part, just a small section of their building. So this simulation lab, students can have access of this simulation lab from the first year itself. And to the university's clinic and the university hostel, students will be able to join from the seventh semester, which is which is the third year. So from third year onwards, you are eligible to do the hands-on practice and do your clinical rotations with the university hospital. Course fee in Germany. Sanjay, as you know, Germany is quite popular for its free education, free of cost education. I am sure everyone is aware about this fact. So if you are getting admission in any of the public university in Germany, the entire tuition fee would be zero. So the tuition fee would be free of cost. It's just the living expenses that you need to bear. And when it comes to the post graduation, you are supposed to you're supposed to get the stipend also, so you can also easily cater your living expenses while doing your post graduation side by side from Germany. So this is one of the biggest advantage of doing MBBS from Georgia. Is number one, it has entered in a European Union, and it will be a free flow of movement to all the students who are willing to settle in any other European country. So you can settle there. Your degree would be highly recognized across the EU countries, and of course, yes, the degree is recognized all over the world. But yes, if you want to settle in European countries, then of course your degree would be of high values. I'm getting 605 to 6010 in NEET UG. No, the chances of me getting a seat is very low. Can I get fee reduction if I apply? Yes, Pavan. Like there's very good facility with Geomed University that they are coming up with, that they are giving free seat for the students who is getting 600 above marks in NEET. So if any student who is scoring 600 above marks in NEET, 2 seats are there with the teaching university Geomed. And for that you need to prove, you need to show the NEET scorecard, and then you are eligible for the complete free of cost MBBS. So you just need to manage your living expenses. Your tuition fee would be free of cost. So this is the criteria that is university was discussing about. I'm not sure whether they have implemented or not, but yes, we had such discussions going on with the management of the university. So students have asked me the questions on Instagram also, whether I be able to join live from Instagram. Oh, for my upcoming webinar, definitely. My upcoming webinar is going to be on the coming Saturday, and for that I will definitely come live through Instagram also. I'm from Kashmir and I want to pursue MBBS from Georgia. Yes, why not? Joseph, you can surely contact us. I'm just dropping the contact numbers here, so you can contact us on the contact numbers mentioned, and we will be definitely assisting you in getting admissions in Georgia. We are doing admissions in all the medical university in Georgia. We have our local office in Tbilisi, and we will be giving you end-to-end support, starting from the admission process, starting from counseling you for the best medical university in Georgia, and then till you complete the course from Georgia. So our support will be end to end till the 6 years of MBBS. Which university will be better to go for, TSMU or SCU? What are the advantages? See, out of these two universities, if you can afford TSMU, then why not TSMU? Because TSMU is the only government medical university in Georgia. It has its own advantages, whereas SEU is a private university. By the way, it doesn't matter whether university is private or government, as long as it is giving you good facilities. It is a good university for you. But if you have asked me the comparison between these two, then definitely I would be suggesting you to go for TSMU, because it's the oldest medical university in Georgia with very high FMG passing rate. And there's no such disadvantage of joining a public or a private university. It's an advantage to join the good university. And When we talk about a good university, when we talk about the advantages, good FMG qualifying rate, good USMLE passing rate, better infrastructure, better clinical rotations, good faculties, all these things matters a lot, which I'm sure TSMU gives you such facility. Indian food availability. Yes, every Indian hostel is fully equipped with Indian mess facilities. So as long as you are staying in an Indian hostel, you will be having 3 time Indian meal. And the hostels in Georgia, they have started giving North Indian and South Indian meal. So you will be having all type of Indian cuisine in the hostel. So if you're from South India, you can have South Indian meal. If you're from North India, you can have North Indian meal. They are giving halal food also. They are giving proper vegan meal also. So you'll be having multiple options of food. So don't worry about food in Georgia at all. In my YouTube videos, I have shown them some good supermarkets also, when you can buy the groceries, when you can easily buy any of the raw food or any type of grocery related to Indian food. How good is SEU? Prasad, I have already discussed a lot about TSMU and SEU. So SEU in particular, like there's no batch passed out from SEU yet. So it's quite a new university. We do not know what is the FMG passing rate. We do not know. And basically it's a university. It's a complete university having multiple faculties. So ma'am here in this webinar has discussed that Teaching University Geomed is a single medical faculty university, whereas in SEU, or there are other universities too, which are big universities and are running more than 50 faculties in the campus. So yes, for medicine there are some good universities, so it's better to prefer. And SEU, yes, you can choose SEU. It has a good infrastructure, it has a good campus. But if you want good clinical rotation, then I would advise to join some other universities like maybe TSMU or ILIA. How is the clinical exposure in Georgian universities? Yes, you can definitely ask about the clinical exposure. All the universities, first of all, they have their own hospitals. Since the earlier they used to have their clinics, but since the NMC has imposed certain regulations, so all universities are right now having their individual hospitals wherein students are doing their clinical rotation, and right away it starts from 7th semester onwards. So from the third year, it will, like after third year your clinical rotation will begin, and the fourth year, fifth year and sixth year will be of clinical rotation. The final sixth year would be of internship, and you will be getting a different a separate document of internship proving that you have done 1 year of state or clinical internship or clerkship in Georgia. So Georgia is 100% it's following the NMC guidelines. Is there Indian? No, there is no Indian embassy in Georgia right now. The nearest Indian embassy is in Armenia. So Indian embassy is not there in Georgia at the moment. When will be the intake starts in Georgia? I want to go there in the beginning of next year. So if you're willing to go to the next year, then yes, you can prefer the March intake, since they have 2 intakes. One is in September and second is in March. What is the most minimum fee of MBBS in Georgia? The minimum is $4,000, and there are 2 universities. One is BSU, Batumi Shotarostavali Tbilisi State University, and second is Akaki Tsereteli State University. So these 2 universities are coming under low budget category, and hence having the lowest tuition fee for medicine in Georgia. What is the most minimum fee of MBBS in Georgia? Okay, so we have covered this. Indian medical system, can you suggest any please? Yes, you can join Akaki Tsereteli State Medical University. It is one of the good university in Georgia under low budget category. But see, again, if you ask me to join a good university, since in Georgia the living cost is quite high, So if you are living in Batumi, or if you are living in Tbilisi, or if you are living in Kutaisi, it doesn't matter. Your living cost is coming around $3,500 or maybe $4,000 per annum, which is the tuition fee of some universities in Georgia. So you are paying a very heavy amount for your living cost. But here in Geomed, Teaching University Geomed, since they are offering their individual hostels to the students, and they are quite affordable to the Indian students. You can live there. You can, by just paying a very small amount. So it is quite affordable. 12th, 39. No. What about FMG passing rate of SEU and Geomed? SEU, like I've told you, the batch is not graduated yet. But yes, Geomed is having the FMG passing rate of more than 65%. Can you repeat the university's name? It is BSU, Batumi Shotarostavili, Tbilisi State University. And second is ATSU, Akaki Tsereteli State University. So these two universities are under the low budget category. So yes, I'm sure, and we'll be doing another webinar for MBBS in Georgia. My upcoming webinar would be of MBBS in Poland, where we'll discuss all the details and universities about Poland, and how to get admission over there, what would be the eligibility criteria. So my next webinar would be of MBBS in Poland, and other than that, I'll be again covering MBBS in Georgia, and then I will be discussing each and every university in detail, so that you will better know which university would be the best possible option for you in Georgia. And yes, Eklavya Overseas is having the lowest consultancy charges. So any student who is likely to take admission in any of the university in Georgia can contact us and get the lowest consultancy charges in India. Yes, they serve halal food. Kokakas University, no, I won't suggest Kokakas University. Instead, I would suggest you Kokakas International. So, Kokakas International, you can definitely proceed, but the FMG passing rate is average, it's around 40 or 45%. So, it's always better to look for a university that is giving you a high FMG passing rate, like Geomed, like DTMU, David Tevelyani, like Tbilisi State Medical University. But yes, if you are looking for a low budget university, if you're not if you're not looking for a university that charges you approximately 55 lakhs or 60 lakhs in total, then definitely go with Geomedi Medical University. Ivane Java Kashvili, they need 50%. This is the basic minimum eligibility for all the universities in general. Basic minimum percentage required is 50 in PCB. Yeah, so that's it. So if you guys have more queries related to MBBS in Georgia, please do contact us on the contact numbers mentioned in the YouTube, and we will definitely assist you with the whole admission process. And we are also giving you a virtual face-to-face counseling to select the best medical university for you. So thank you so much. Yeah, you're welcome.